Sickle cell disease is a systemic disorder, and a whole constellation of symptoms can present. For example, sickle cell disease can present with anemia, dark urine, sclera icterus, which is yellowing of the sclera, edema of the hands and feet, sickle cell retinopathy, as well as traumatic hyphema. Hyphema is a collection of the blood in the anterior chamber. Complications that can arise from sickle cell disease includes the vaso-occlusive crisis. This occurs when there is significant occlusion from sickling of the red blood cells, and it is a painful sensation in the extremities, back, chest, and abdomen in particular. Acute chest syndrome is the most common cause of death from sickle cell disease. This is pulmonary infiltrates, according to radiography, plus one of the three, fever, chest pain, and lung presentations like tachypnea, wheeze, and cough. Hemolysis, or breakdown of red blood cells, cholelithiasis, or gallstones, and pulmonary hypertension are also presentations and complications that you should not ignore. Chronic organ damage from this disease includes the spleen and in the extremities, forming leg ulcers, and even DVTs, which is deep vein thrombosis, renal disease, osteonecrosis, and erectile dysfunction or infertility. Blood may be found in urine, and urine's osmolarity may be elevated. Stroke can occur from sickle cell disease, as the sickling occurs within the vasculature of the brain as well. And sickle cell retinopathy, which we'll cover in this subsequent slides, can also happen as a complication. In sickle cell retinopathy, one of the end organ complications of sickle cell disease, there are 5 stages that we should be concerned about. Stage 1 is when there's no proliferation, and it can present in the retina as venous tortuosity, salmon patch hemorrhages, and iridescent spots. Cottonwool spots for infarction, and hairpin vascular loops and macular infarction can also occur. Angioid streaks, sunburst, scars, as you can see in dark patches in the right top photo there, can occur, and comma-shaped conjunctival or optic nerve head vessels, as well as peripheral arterial occlusions can also occur. In stage 2, AV anastomosis, peripheral silver wire vessels, and shunt vessels can be formed and observed. Stage 3 is the proliferative and neovascular stage. You'll see a C fan-shaped peripheral neovascularization. And in stage 4, there is vitreous hemorrhage, from the contraction bands contracting around the C fans. Lastly, in stage 5, retinal detachment can occur, either tractional or rhegmatogenous. This can form from contraction of the vitreous traction bands from stage 4. Beta thalassemia, hemolytic anemia, or pulmonary embolism within the lungs can be alternative diagnoses. For sickle cell retinopathy itself, and with slight or non-apparent symptoms of other sickle cell disease symptoms, the differential diagnosis can be diabetic retinopathy, Eales disease, simple vascular occlusion within the retina, ocular ischemic syndrome, and hyperviscosity syndromes, like polycythemia vera and Waldenstrom's macroglobulinemia.